everyone, it's Sabrina from the Gombe family. So today I wanted to talk about my medical experiences in Kenya thus far. So I actually have quite a few, so you get a variety of different experiences along with a variety of different clinics and hospitals that we've went to and kind of what we've determined that our future route is going to be for future medical issues. So I want to start with the most long-term issue that I've had since I've been in Kenya, and that has been UTIs. So for you, the people that don't know what a UTI is, it's a urinary tract infection. So I started getting UTIs pretty much right when I got here. I would say maybe a week, at most 2 weeks into being here, I started experiencing the typical UTI pains. And I have had a UTI once or twice before, long time ago, maybe when Safari was a baby, and I never even looked it up. I just went to the doctor, they gave me some antibiotics, went away right away. But this time was a very different story. And I think that that's because of how they treat UTIs here. UTIs are very typical here. That is one of the most common issues that women have here. And I believe I looked up the statistics, like 80% of women in Kenya, or I think it might have been Africa, have UTIs at least once or twice in their lifetime, and often like more common than that. So it's such a common issue that women actually go to these clinics, and the clinics, the first clinic that I went to and I told them my issues and they did a urine sample, the doctor actually had a pile of this standard medicine, this standard IV antibiotic that they give to pretty much all the women that come in and say that they have UTIs. So they just did a urine sample, which is just a dipstick sample, so it wasn't like a urine culture or anything. So he just gave me this medicine and was like, oh, you'll feel better, be on your way, right? It was 2 doses, I think. So it was that day, and then the next day I went back, and so that made things better for a short period of time. So that was when we were in Nairobi for something. And so we left Nairobi and we went back to where we live on the coast. And then it came back very soon afterwards. I think it didn't even really go away. It got a little better but didn't go away. And so then we went to the clinic in Tezo, which is where we were living, and he was like, oh, do you know what antibiotic they give you before? And I was like, no, I don't. Unfortunately, I didn't keep track of it. And he was like, okay, well, I think this one is a different one. This one will definitely clear it up, make it better. Everything will be back to normal. I was like, okay. And so they gave me, I believe this was pills instead of IV. So I take the pills, and it starts getting a little bit better. And I don't think it ever went away that time either. I just think that it was a little bit better, a little improvement. But sex was still very uncomfortable, and it was still definitely not back to normal. So after that, then the Tezo clinic said, okay, maybe you should go to a laboratory and get a culture done, which is where they take your morning urine and then they wait 3 days and they see like what has grown. And so they did that and they said that it was E. coli. So I was like, okay, that's like the most common form of UTI, which is a good thing, right? But then I kind of just started looking it up myself because I wasn't getting anywhere with any of these doctors, right? They just kind of treated me just like the next patient, right? Which my body might be different than the next patient because I'm not from here, you know? My body operates different than somebody who is from here. So nothing was working. So I looked it up, and nitrofurantoin seemed to be the most common drug that I was capable of getting here that would help things. So I started taking that antibiotic, which I can get at any pharmacy without having to get a prescription. So I started taking that, and then I started putting myself in Facebook groups of UTI people and getting information from them, what I should do. And then I started looking into like food and how limiting this food or taking out this food or eating more of this food could help my situation. So I started doing that a little bit. The food thing I didn't start doing so much at this point. So then the UTI just kept getting worse. Even with the antibiotics, I had my mom send me some medicine from America that's like over-the-counter medicine, but that's really good for UTIs. And so I was taking that along with Tylenol, along with the antibiotics, along with cranberry pills, all of these things. I was taking like 10 to 15 pills in the morning and the same at night. It was ridiculous. And so a lot of things kind of came together where I was like, I need a better working environment where the electricity is more stable, and I want to be in Nairobi where I can possibly see better doctors that can fix me. So we decided to move to Nairobi, and that was about 3 to 4 months ago now. And so I tried to deal with it myself, and it was just exhausting. And I was just getting completely depressed. And I'm newly married, so we want to have a good time in the bedroom, and that wasn't really happening. Even if we would have sex once a week, it would be very uncomfortable for me, and I would feel like I needed to heal for a week after that. So it was just horrible. And one Sunday, I was just like, I can't do this anymore. So we went to the most expensive hospital in Nairobi, which is Aga. And we went there, and the OBGYN area was like closed, like they weren't taking any appointments or whatever on that day because it was a Sunday. And so we went to the emergency room section, which was completely pointless. And so we paid to see a doctor who was like, oh, okay, let me give you this referral. So we paid for the referral. He didn't check me, he didn't do anything. So then they scheduled me an appointment for the OBGYN gynecologist area. So that next appointment was on Saturday at 3:45 the next week, right? So I wait until then, and I go with my daughters, and then I go to the gynecologist department, and I say, okay, here's my paper, I have an appointment. And they're like, this doctor's not even here on Saturdays. And I was like, are you kidding me? I paid like 1,000 shillings for a car to come here. I have to pay 1,000 shillings for a car to go back. I need to see somebody today. And so they're like, oh, okay, right? And so then they're like, oh, well, you could see the doctor that's still here. So originally I was supposed to see Dr. Akila. So remember that name. So this time I forgot what the doctor's name is, but I saw this doctor, and I really liked him. He was like, okay, we're gonna get you some tests done. We're gonna get through this together. I'm gonna give you this antibiotic to try at home. It's 2 doses that are like 2 or 3 days apart. And then after that, you're gonna come back and you're gonna get an ultrasound done to see what's going on in there. And you're gonna get this test done and blah, blah, blah. Very supportive, right? And so that was awesome. I was like, okay, like I've heard people in the Facebook group say like, no doctor wants to help me and they think I'm crazy and blah, blah, blah. So I was just like, is this going to be my life, right? So then this doctor that I see, not even the doctor I was intending to see, right? I don't know any of them, but he was amazing. So he was like, we're gonna get through this together. Schedule you an appointment for Wednesday. You're going to do the ultrasound that morning. Then you're going to come here and we're going to look at it together. All this stuff. So I was very, very positive about this. So we come back on Wednesday and I do the ultrasound and the other test, I think a urine test for something. And then I go to the gynecologist and they're like, oh, the doctor that you've seen that made your appointment before, he's not here. He had an emergency situation with his family. He couldn't be here. And I was just like, are you kidding me? Like, I finally find a doctor that's like willing to see me through with this, and he's not there. I was like, so I need to be seen. Like, I just had these tests. I need to talk to a doctor. They're like, okay, you can talk to the doctor that's here, Dr. Akila. So I was originally supposed to see Dr. Akila. Then I saw the amazing doctor, And then the amazing doctor scheduled me for a second appointment. The amazing doctor had to not be there for whatever reason. And so then now I have to see Dr. Aquila, which I don't know if this is a good or bad person. Never met them before in my life, right? So then I go in to meet with Dr. Aquila. So I'm sitting there and he's looking at the tests that I had done that morning. And he's like, what makes you, no, let me show you how he was sitting, okay? He was sitting in a chair just like this, slouched back with his hands over his fat belly like this. And he's looking at his computer. He's like, so what makes you think that you have a UTI? And I was like, I've been told by multiple doctors that I have a UTI. They've given me antibiotics for the UTI. It hasn't helped the pain any. He's like, I'm looking at your test results right here, and you don't have a UTI. And I was like, okay. What we can agree on, though, is that I am still in pain, and that needs to be handled. And he was like, okay, so we could either go one of two ways with this. And this is his tone the whole time, like I'm some stupid idiot or I'm insane, right? We can either go one of two ways with this. You can decide that you want to be treated as if you have a UTI, even though clearly here it says that you don't. Or you can be treated in a different way. And I was like, okay, like what other way, like what other options? And he was like you can go see a psychologist. Okay. So at this point, I'm very pissed off that I'm getting this type of attention from this doctor where the other doctor was amazing, right? So I was like, I feel like I'm not getting any help from you. And he was like, really? I was like, yeah, the other doctor that I saw on Saturday was amazing. He said that he was going to be there through this process. He was going to help me, blah, blah, blah. And he was like, I'm sorry you feel that way. I was like, I'm sorry that I feel this way too, but I really would rather see that doctor. And he was like, then you can make an appointment to see that doctor. And I was like, okay, am I going to get paid my money back? Because this is the most expensive hospital in Nairobi. So it cost about $45 just to look at the face of a doctor at this place. So I was like, am I going to get my money back? He was like, I don't work in finance. I don't know how that goes. I was like, okay, well, let me tell you how your hospital goes. So you have to pay this $45 every time you see a doctor. Since you have not helped me whatsoever, you need to tell them that I need to be seen again and not have to pay again. And he was like, I can't do that. I was like, wow, okay. So I looked at him straight in his face and I was like, you're a fucking asshole. And he was like, you can't say that to me. I was like, yeah, I can, I just did. And I get my bag and I like walk out. And so he starts following me because in Kenya, in America, like you could like call someone an asshole or you could like road rage, oh, you fuck you, right? But in Kenya, like it's not so much like that. And those words are taken a lot more seriously. So he follows me and he's like going up to the nurses like, come with me. And I get my daughters and I go to the elevator. I push the elevator button and he comes and he follows me with the two nurses and he's like, she called me a fucking asshole. I was like, he is a fucking asshole. And they're like, right? And so the elevator was taking forever. So me and the girls go downstairs. And so then the nurse like runs to go downstairs so she can get there like before us, right? And so then she goes up to the security guard and she's like, you need to stop her. She can't leave. And so he grabbed my arm. I was like, don't touch me. And I like got my daughters and I walked out, right? And so then we like went back home and I wanted to give you that experience so that you could understand that, first of all, if you're ever in Nairobi, Aga Khan I wouldn't recommend, and Dr. Aquila, specifically, gynecologist, is a horrible person. So don't ever go to him. Very bad temper, very bad, non-existent bedside manner, just so you know. But I also wanted to give you all of that to illustrate to you how fed up I was, thinking that I was just gonna have to deal with this pain forever. So I came back home and I was like, the only way that I'm going to get through this is if I take it upon myself to fix this. So I started researching, I started looking up foods I can eat, foods I can't eat. I was looking up UTIs as well as ICs. I forgot what IC stands for, but it's just basically like general pain in that area that there's not really a cure for. So I was looking at the diet for UTIs and the diet for IC, and I was comparing like, okay, this is good for both of them. This is not good for one of them, so I'm not gonna eat it, you know? And I was trying to figure out, I was being my own doctor, and you'll see that in this whole video. Every situation medically that we've had, I've determined that I have to be our own doctor or it's not going to get solved. I research, I find out what medication we need, I go to the pharmacy myself, I don't need a prescription, and I get the medication that we need and I fix the problem. Because the doctors are just not as educated here or not as willing to help. I'm not sure. So I did that and I started really being on top of my diet, and I can't eat this and I can't eat that. That's when we decided to be vegan. So we just did recently a video on being vegan in Kenya. So I said it was for a medical reason, and this is it, that I had UTIs horribly and I was just so depressed. My quality of life was horrible. Like going anywhere was just like, nope, I'd rather stay home. I'd rather stay home so I could be close to the bathroom, because you always feel like you have to go pee. It's just horrible. So that was the situation with UTIs and how I managed that. Now I am much better. I don't even think about it anymore, and it's completely cleared up. I eat very, very healthy. We have nuts and seeds for snacks. We have no meat, no dairy whatsoever in our diet, and I'm feeling so much healthier. So that is a positive outcome of the UTI situation. So now I want to go to another situation that I've personally experienced, which was food poisoning. So I can only talk about what I think it was. So yeah, we could go off of that. So me and Shaha, this was when the girls were in school in Trinity, the first school that they went to in Tezel. And it was lunchtime, so me and Shaha went to a little hotel. One that we don't typically go to, but the one that we usually go to, it was closed down for like reconstruction because it was during Ramadan. So we went to this other one, and we'd never been there before. I'd seen it, but never been there. And so we ordered pilau, which is a rice dish. And then we ordered, I ordered potatoes, but Shaha didn't have any potatoes. And they're like the fried potatoes that they usually have here, which is like potato, and then it's dipped in like flour and water and then fried. And so often they will fry them all together, like a huge batch, and then they'll let them sit there all day until lunch is over, and then usually they'll be sold out by the end of lunch, and then they'll do a different batch for dinner. So if you come as a late lunch person, those potatoes could have been sitting there for hours, right? And so we go and I get like 6 potatoes, I think, and they're just like little pieces of potatoes. I get 6 of those and I eat my pilau, and the potatoes were good. I remember telling Shaha that they would have been 10 times better if they were hot, because they were like not even lukewarm. They were cold. And so I eat those and go on about my day, right? Me and Shaha both had pilau, so I don't think it could have been the pilau. And then the girls come home, we have dinner together, everything's fine. So then I wake up at 2 o'clock in the morning and I'm in so much pain. And so I had diarrhea really bad, and I don't remember if I was throwing up. I don't think I was throwing up yet. I just had diarrhea. And then I like come out of the bathroom and I sit like right near the kitchen area outside the bathroom, and Shaha comes out because he's like, why hasn't she come back to bed? And I was like, I'm dying. And he was like, what do you mean? Like, what's wrong? And I think maybe by this time I had thrown up, and I was like, I'm throwing up and I have diarrhea so bad and I'm in so much pain. And he was like, okay, like, I'll take you to the hospital, the clinic. So we go to the clinic, and just so happens to be that somebody was giving birth to their baby at the clinic. And this is a clinic with like one doctor and one laboratory person and maybe a secretary, and that's it, right? So doctor's preoccupied. So this is 2 minutes away from our house. So we go back to our house, and I'm just in so much pain. And so like I tried to sleep and I can't sleep, and it was just miserable. So then around 6 or 7, I think 6 o'clock in the morning, like Shaha goes to see if the clinic was like free so that he could take me there. And so as he's like leaving, I had diarrhea and throwing up at the same time. It was horrible. And so then he comes right back, and he's like, and so I'm trying to like clean up my disgusting mess, right? And like Safari is like, Mom, like, can I help you? And Georgina like doesn't know what to do. And so he comes back and he takes me back. And so then they like give me an IV and kind of just like let me lay on the bed while like the IV's going for a little bit. And then they give me like another medication, and they say, I'm pretty sure that she has food poisoning. And we're like, what about, what's the thing that you get from mosquitoes? Malaria. What about malaria? And we're like, he was like, I don't think so. Like, I don't think this would be malaria because of this, and this. I'm pretty sure it's food poisoning. So they gave me the IV and I think a couple other medicines, I don't remember, and sent me on my way after the IV was done. And just so you guys get an understanding, yes, there is not really like medical insurance here, in the sense that like in America you might pay a copay here or there, but you have insurance. Here is not so much like that, but for an IV and multiple other medicines that they gave me and the time spent at the clinic, it cost me less than $10. So there's that. So we don't mind not having insurance here at all. So that was kind of the food poisoning situation and how it was handled. I think it was handled very well. I think the only culprit could have been the potatoes, but I don't know. I mean, it could have been the fact that like I am not used to the pilau or the way things are cooked here, and Shaha is used to it, so it could have been the pilau too. I'm not sure, but it was horrible, and I'm glad that's over with. And now I'm very cautious about going to any hotels or anything like that. So that was food poisoning. Now I want to talk about some much more common things that happen to foreigners and locals here. So one is MRSA. So MRSA is a type of staph infection. I have actually had MRSA for over 12 years now, and it's not something that you could just see like, oh, she has that, but it comes and goes. So it's a very serious staph infection that could kill you if left untreated when you have like wounds that are actually the MRSA. But since I lived in America, like I might get a little breakout here or a little breakout there, but it's not ever a big deal. So coming here and having a different level of hygiene, a different environment, it started showing again. So I had a couple serious spots, and in this portion of the video I'll put up some pictures because there was pictures of certain things that I'm about to talk about next. So one particular instance was I had MRSA on my second biggest toe on one of my feet because I had started wearing different sandals, or maybe the same sandals, but we had walked a really long distance one day, and so I had got a blister on my foot. Okay, fine. But because of the level of hygiene, the amount of like disease that's in the soil, that blister was constantly getting touched by the soil or touched by whatever, right? And that caused MRSA to flare up on my toe. And it was so bad. I'll put a picture here. It was so bad. Like I couldn't even walk. It was horrible, and it's huge. It kind of looks like a pimple at first, but a pimple that you can't pop. So a pimple usually has a white spot that indicates that you could like pop it and then it'll go away quickly. But with MRSA, it has a white spot on it, and so you think, oh, I could pop it, and then you kind of like open the wound by trying to pop it, and then the white part just gets bigger and bigger and bigger until eventually like the white part like falls out, and then it kind of starts healing up. But this took a long time to heal, and so I went to the clinic and showed them, and they gave me a cream for it, and they gave me an antibiotic for it, and eventually putting the cream on it like a lot and just like trying not to walk on it very often, trying not to cover it with socks, it eventually went away. But that took a long time to go away. So speaking of staph infections, one of the common staph infections here is, I don't have a name for it, but I can tell you what it looks like. So it looks like just like red bumps, like all over, mainly a child. So I haven't seen it on any adults here, but I had a couple of these spots. They're very itchy, and it's not a mosquito bite for sure, but it's just, I don't really know like what it's from, but a lot of the kids have it here. One of my nephews, he's only 1 year old, and his head would be covered in these bumps, right? But the thing is, I think what happens is the body gets immune to it around puberty age, because I haven't seen anybody older than puberty having these spots. Shaha's never had them, but I had them, and both of the girls had them. Actually, Georgina's sister, Rachel, she had these bumps so bad, and then they got infected. And so it almost looked like a MRSA situation, but it was all along right here, around her like armpit, shoulder area, and it was like all white inside. So it was like a huge wound like this. Like a bunch of those red dots had formed together, and then it was all white inside because it got infected. And so after I saw that, nobody even told me about it. We went to the village, and she was wearing something that kind of showed her shoulder, and I was like, Rachel, come here. And I looked at it and I was like, Shaha, what is this? We need to take this child to the clinic right now. So we got her some antibiotics, some liquid antibiotics, and we got her a cream, and then we got her a pill. I don't know exactly what the pill was, maybe another type of antibiotic. And so we explained to his mom like how she needs to take these medicines, and it soon cleared up. I'll actually put up here a picture of her wound as well, because I have a picture of that. And it was just like so disheartening to see, because she's only 5 years old, you know, and a lot of people in the village, they don't have money to take their kids to the clinic or whatever, you know, so it's kind of just like, oh, okay, well, I hope it goes away, you know. I know of another kid in the village, she accidentally burned herself really bad on the stove when they were cooking ugali, and she had like a burn mark very large on her leg, and her mom doesn't have much money, so she can't just be like, oh, let's take you to the clinic, oh, let's get you some cream. Like, she literally just has to hold her and comfort her, and I'm sorry this happened, be more careful. She can't do anything to help with the pain, to ease the pain, to quicken the healing, anything. And it's just so heartbreaking. So that is the staph infection situation, and how horrible it is that it's just so common here in the village. So with Rachel, or with Georgina and Safari, they had bumps, but they never got to the infected point like Rachel. So they also got a cream and an antibiotic, and we made sure that we were on top of those. But just being in that environment in Tazo, where this is just so common, they would go away and then they would come back. Then they would go away, then they would come back, just because of the environment that we lived in. So that was a serious issue. And coincidentally, since we have lived in Nairobi, they haven't had one bump. So it's just kind of like, okay, environment must be a significant factor to this issue. Another issue that we had is ringworm. So Georgina never had this that I remember. Safari had this really bad on her leg. I think, yeah, it was her leg. And I don't have a picture of this one, I don't think, but she had it really bad on her leg. And of course, like, ringworm is pretty identifiable because it's like a circle, right? So I was like, this must be ringworm. So then, of course, I told you before, I kind of just look things up myself and decide what is the best option. So I look it up myself and what is the best antibiotic and cream for ringworm. And then I just go to the pharmacy and say, I need this, this, and this. So I did that. We have a serious first aid kit, if you could see over here, that red bag. And that's because I have to look everything up myself and decide what is best for my family, because medical facilities are just not the best here compared to where we're from. And I don't blame Kenya. Kenya is still very up and coming, you know, but I do know that I need to take care of my family. So that's what I have done. And I got what I needed to get for the ringworm, and I put it on her every day. We used an alcohol swab to make sure it was clean all the time, and it went away. She hasn't had any issues of ringworm since that instance, and especially since we've been in Nairobi. So those are the 4 situations that I wanted to discuss with you: the UTIs, the food poisoning, the MRSA staph infections, and the ringworm. So I hope that you guys got a lot of information from this, especially if you plan to move to Kenya and you have to think about how you are going to get medical assistance when that arises. So please let me know, like, do you intend on getting traveler's insurance if you come here because it's so cheap? Do you just intend on paying for it yourself? What is your goals and your path when it comes to medical issues if you ever traveled to Kenya? I would love to hear it. But our personal experience, we have decided that unless it's something serious where one of us is dying, we would just rather take that upon ourselves to research. My husband is a doctor. He works with casting and fixing broken bones. So his medical background coupled with my passion to be the doctor of my family, it has worked well for us thus far, and we're in a really good medical position now. So I hope you guys like this video. I would love to hear your opinions about this and any experience you've had being your family's own doctor just from research. So please like, comment, share, and subscribe, and I will see you guys in the next video. Bye!